Well, a few weeks in, everybody's starting to adjust to the new school year. Fingers crossed it's smooth sailing for the next 9 months. But if you need help keeping your student healthy, you should know about OneWorld School-Based Health Centers. Sarah Miller is a pediatric nurse practitioner and the associate medical director behind this program. It's good to see you.
Nice to
Talking about barbecue, I know, in the studio. We'll try to send you home with some. Maybe Tony will leave a little bit for you for lunch today. Let's talk about these centers and the idea in general behind them, and then we'll discuss where they are.
Sure. So we have been in the Omaha Public Schools in partnership with Building Healthy Futures and Omaha Public Schools to be in 8 public schools, Indian Hill, Liberty, Spring Lake, Bryan High School, Northwest High School, Belvedere, King Science, and Kellum. We started because we wanted to start eliminating kiddos from being out of school. So seat time is super important, and absenteeism, and so in order to combat that, we wanted to be able to offer healthcare services so that kiddos could get what they needed within the school day.
But you're not replacing their primary care physicians.
We're not there to replace by any means. We are just there as mostly 50% of the kids that come don't have a primary care provider, so weren't seeking care anyway. And so we are really meeting a need that our community has that we didn't even know existed.
Who can be seen then at these 8, as we saw the list there, the 8 centers?
Right. So we are for Omaha, anyone who goes to Omaha Public Schools, 19 and under. We also will see a sibling. So say your sibling is, 4 or 5, not ready for school, we can see them as well.
Or attends one of the other schools in the area, but that sibling is at one of the 8 with the center.
For sure, for sure.
So the types of services, if you're not again, we're not replacing doctors here, but if you don't have a doctor, or you need to be seen that day, what are like, is it for sore throat? I've got like this. I mean, what are you looking at?
Right. So we're again, it's nurse practitioners and physician assistants who do primary care. So your sore throats, your strep throat, your cold, flu,
pink eye,
definitely that type of stuff. In addition, if you need a flu shot or flu mist as well, we can do that, as well as any vaccines that you need. So
well, that season's coming.
It
the whole
truly
flu shot, right? We know we're going to be hearing a lot about it, trying to keep everybody healthy. Is there a cost?
There is a cost. We're not free. However, we do accept all insurance plans, as well as Medicaid. We also have a sliding fee scale. So as long as you bring in a month's worth of pay stubs, we can work with you to get a pay scale for you so that we're not breaking the bank.
Bringing it within reach, because that is the foundation of OneWorld. Whether it's this program or anything you do. Access.
Right, access for sure.
Is why you exist.
And we won't turn anybody away. So
how can parents then enroll their students? Is there something they need to do now, or do you just wait until you need to see somebody?
Right, well, and there's 2 different processes. We are totally great with that. I woke up this morning, my kid's eyes, matted shut, and I need to see someone. We're there for that. But we also, you can be proactive and give us a call. We ask that you do a enrollment form. What basically that tells us is we're able to talk with the school staff so that when you do come in with that matted eye, we can say, hey, we got him on medicine, we can get him back to class, so we can have that conversation, as well as some health history so that we can get all of your health needs met as long as
we're focusing on health here. Are there other services available in addition to health care?
Right. So we also have Medicaid outreach worker that works for us, and so those folks that aren't sure if they qualify or anything like that, we have a worker that is dedicated to helping you get enrolled in Medicaid or the Affordable Care Act, as well as services in the community. She really does a lot of social work stuff, so connecting to whether you need food or clothing, things like that.
Are school nurses still in some of these schools?
So we are so lucky in Omaha to have school nurses at all of our schools. There's 96 schools, and some of them share time. So our school nurses are our greatest advocate and greatest partners. So
they're still in those schools with these programs?
They act kind of like your triage nurse. So if you were calling your medical clinic to say, hey, I'm not really sure, they're that person live at your school. And so they're extremely helpful in triaging to help get kiddos in when they need it.
So when we talk about why all of this came to be, What was the main objective? What were some of the issues you mentioned earlier? Absenteeism was one of them.
Right, absenteeism, and then again, helping those kiddos get their healthcare needs met. Before the school-based health centers, kids would be not able to go to school until they got that last varicella chickenpox shot or vaccines before kindergarten, and so they wouldn't go to school until they had them. And so since then, as long as there's a school-based health center, nobody's had to stay at home.
Yeah, education is so important.
True.
We know that, and so the more obstacles you can eliminate, and the better you can make it for families to keep those kids in class.
Right.
It's so important, and that they feel good while they're there.
Right.
That they're not distracted, and that they're not going home, and more people are getting sick, and whatever the case may be. But it is at this point in 8 schools.
Yes.
And you see them on the screens there, and the phone numbers respective to each of those schools in case you have questions for OneWorld in general. The address that's here, that's the one, right? This is headquarters.
Right, this is
But there are
headquarters.
several clinics around the area. Again, it paints this picture of access, and you can learn more about that mission online. It's oneworldomaha.org. Thank you for being here today.
Thank you for having me.
Seriously, grab some Q on the way. No, I wish we had a show chef, somebody who was here every day to feed all of our guests. I think everybody would want to come.
Yes, indeed. Well, it's a pleasure to be here. Thank you.
And today,